Good afternoon. My name is Barbara Collins and I'm President and CEO of Humber River Hospital. I'd like to welcome to the community of North York West the Premier of Ontario, the Honourable Doug Ford, the Minister of Long-Term Care, the Honourable Merrilee Fullerton, MPP Baber, an MPP, and of course the Mayor of Toronto, Mr. John Tory. It is a pleasure for me to also introduce our Humber River Hospital Board Chair, Mr. Tory. Welcome and thank you for coming together to make today's announcement possible. I am honored and humbled to be here speaking on behalf of the Humber River Hospital team, the Northwest Toronto OHT, and our incredible healthcare professionals and staff who are committed to building a healthier community every day. It is inspiring to see their courage and sacrifice in the fight against this unprecedented global healthcare crisis we call COVID-19. We cannot say enough thank you to our teams for all that you do. In recognizing the issues and the challenges this pandemic has created, Premier Ford and Minister Fullerton, please accept our thanks to you, your cabinet and government colleagues for your strong and progressive leadership throughout this unprecedented crisis. Premier, your passion for the people, your true sense of responsibility and your love for the province of Ontario that many of us at Humber River already knew about allowed you to guide this province through this crisis with compassion, authenticity. You have our respect and our thanks. When healthcare leaders work together to provide appropriate care in the best settings, we deliver a better patient care experience because connected healthcare always puts patients' needs front and center. I want to take a moment and share a story with you. One of the long-term care homes in our community was experiencing difficulty managing COVID-19. Minister Fullerton and Minister Elliott asked us to help provide care for the patients. A group of 10 Humber River Hospital staff in the long-term care home did so for 6 weeks. And at the end of that time, when one of our nurses, very experienced nurse, who had always worked in the most acute settings in critical care, was ready to leave, she wrote me a note to say, "I am so proud and thankful to have worked well under such exceptional circumstances. My personal takeaway from this experience is even though taking care of this demographic is not outside my own wheelhouse and my scope of practice, it was an opportunity to return back to grassroots nursing and to provide the most basic care needs to the most vulnerable individuals of society. And if need be, I would happily do it again." And Tracy did for a second time. Simply put, Ontario is stronger when we work together, but along the way, through adversity, we often make new friends. As the fastest growing age group in Ontario, the population of seniors will more than double over the next 15 years. Seniors currently make up 73% of Humber's patient population. Responding to the complex healthcare needs of our aging population requires tireless collaboration between leaders in the community and in government. I have had the opportunity to speak with Premier Ford and Minister Fullerton during this health crisis about how we can continue to support each other in delivering the best health outcomes for the people of Ontario. Today, Premier Ford is here, as promised, delivering results for our aging loved ones in North York and across Ontario with an important announcement. Thank you, Premier Ford and Minister Fullerton, for putting your trust in the trust of Ontarians in Humber River Hospital as we work together to respond to the community's healthcare needs today and tomorrow. We are committed to working together with our colleagues at the Ministry of Long-Term Care, Infrastructure Ontario, and the City of Toronto to show that we can come together and deliver results for our community. It is now my great pleasure to introduce our friend, Premier of Ontario, the Honourable Doug Ford. Thank you.
Thank you. Well, thank you so much, Barb, and thank you for those kind words. It's great to be back at Humber River Hospital. This is an amazing facility, one of the best in Canada, with amazing dedicated staff. And Humber River Hospital will always have a special place in my heart and my family's heart. I was born at the old Humber Hospital along with all my siblings. The staff always go above and beyond every single day. And of course, the late Dr. Devlin was a great friend. Dr. Devlin was deeply committed to this hospital. He was a driving force behind North America's first fully digital hospital. And Dr. Devlin will always be remembered for his incredible work. So Barb, it's really good to see you continuing the great work happening here at Humber River. I'm so excited to be here with Minister Fullerton, local MPPs Roman Baber, Robin Martin, Stan Cho, and our great PA for long-term care, Effie Trianopoulos, and Minister Lecce Ntobolo. This is an incredible team, and they're delivering the results. It's great to see Mayor Tory here as well. Mayor Tory has been a true ally, and during our historic negotiations with the federal government, when we needed to stay united, the Mayor stood behind Ontario, and thank you so much for that, Mayor. I also want to thank the team at Humber River Hospital, all heroic nurses, doctors, paramedics, personal support workers, and hospital staff who have gone above and beyond the last few months. Thank you for being there when we needed you most at Downsview Long-Term Care Home, Villa Colomba, and so many other long-term care homes in the area. And we're all here today because we care about our seniors. We believe every senior in long-term care homes deserve a safe, comfortable place to call home. As you know, we inherited a broken system. It was a crisis, decades in the making. And it didn't start with us, but I can assure you, my friends, all of us were going to fix it. As Premier, I made a commitment. We're building 30,000 long-term care beds over the next decade. Our government will be investing $1.75 billion in long-term care homes over the next 5 years. We're going to build new beds, new facilities. We're going to redevelop older beds and older homes with modern design standards, air conditioning, private and semi-private rooms, the latest medical technology, because that's what our seniors deserve. I want to quickly recognize Marcoto Mechanical, Paul over there. They're just absolutely incredible. They donated a cooling rooftop unit to a long-term care home in Vaughan. Paul, I want to thank you. I want to thank your company. What an incredible donation that was. We all have a role to play in making long-term care better. My friends, we're putting forward bold new solutions. We're working with our hospital partners and Infrastructure Ontario to deliver new beds in months, not years, because there's no time to waste. We're starting projects in Mississauga and Ajax, and today I'm proud to announce the third historic new long-term care project we have delivered in the last few weeks. Together, we will deliver 320 new long-term care beds for Toronto by the end of 2021. My friends, this is the power of partnership. We're getting our seniors off wait lists, we're building more homes, and that feels like home and giving our loved ones the dignity and care they deserve. We're building a better long-term care system for Ontario, and it starts right here, right now. Thank you, and God bless the people of Ontario. Now I'll turn it over to Dr. Fullerton.
Thank you, Premier. It really is a pleasure to be here today. And a big thank you goes out to Barb Collins, President and CEO of Humber River Hospital, for your partnership in this project. And for all of you and your colleagues who have done so much for long-term care residents throughout COVID-19 pandemic, you truly have been healthcare champions. I also want to thank Mayor John Tory and Michael Lindsay, President of Project Delivery at Infrastructure Ontario, for joining us today. Both Premier Ford and MPP Baber have been tireless advocates on behalf of constituents who need long-term care across this city. And we know that the shortage of long-term care beds in Ontario puts strain on our broader healthcare system and on the thousands of seniors waiting currently in hospital for admission to long-term care. The reality is that Toronto has one of the highest wait times for a long-term care space in Ontario. The provincial median wait time for a long-term care space is 139 days. Across the 5 local health integration networks represented in the City of Toronto, the median wait time is 194 days. Our government is committed to improving this number, and we are taking action to rebuild and advance long-term care. We remain steadfast in our promise to provide our most vulnerable people with the care they need in a safe and comfortable living space. We will do this by modernizing the long-term care sector and creating capacity throughout the province. What we are announcing today is another example of finding modern solutions and innovative ways to provide the care that our vulnerable seniors need. And currently, it takes approximately 36 months to build a long-term care home once a site and financing has been secured. But through a range of enabling measures, such as modular design and construction, rapid procurement, improved construction times, and the use of hospital lands, we are targeting occupancy of this new long-term care home in 2021. It is important to note that these beds, 320 of them for our vulnerable people, will call home and will be new capacity in our long-term care system. Through innovation, partnership, and modern solutions, our government will continue to improve our long-term care system and create new and modern spaces for our aging loved ones to call home and get the care they need and deserve. Thank you. Mayor Tory will now say a few words.
Well, Premier and Minister and MPP Baber and President Barb, first of all, it's always great for me to have an opportunity to get a 2-for-1 deal on buttering people up. And I'll start with the Premier, of course, because he is a person, I know he thinks that every time I see him, I ask him for support for Toronto in one way or another, and I do, because it's my job. But I just remind him that Toronto is like a high-performance engine, which requires a bit of oil from time to time. It requires for the tank to be filled up and the battery to be charged so that we can continue to perform on a high-performance basis to help drive the economy of this province. And so I'll do a little buttering up on him in a moment. But the second buttering up for today is Barb Collins. My daughter's a medical doctor here, and so I guess Barb is theoretically her boss, and so therefore she told me to tell you you're doing a fine job. You're one of the best, as the Premier would say, you're a champion among hospital CEOs. I am seriously very pleased to be here today with the Premier and the Minister and the MPPs that are here. And I will say to you, because it's the first chance that I've had to appear at a public occasion like this with the Premier, he has been a great partner for our city during the COVID-19 pandemic and has worked collaboratively throughout. We have found ways together to solve problems consistent with the health and medical advice that we've received, the excellent health and medical advice that we've received. I'm also delighted, as I said, to be here with Barb Collins and with Minister Merrilee Fullerton and MPP Baber. You know, COVID-19 has taught us many lessons. A major takeaway for our city, and I'm sure for our province and for other communities, is the need for more long-term care beds. Some of our city's most vulnerable, frail seniors were heavily impacted upon at the start of the pandemic. We tragically lost far too many seniors, and many others continue to deal with the lasting effects of COVID-19. We need to take care of our vulnerable seniors in our long-term care homes. And this will involve careful attention, yes, to current conditions and compliance, which we're working hard to address at the city level, and we look forward to continuing to work with the province on that as well. And today's announcement, which is nothing but very, very good news for Toronto and for the province and for seniors, is another significant step forward when it comes to more and better long-term care being made available to the people of Toronto and the people of Ontario. By expediting the creation of literally hundreds of new long-term care residences at Humber River Hospital, the province is demonstrating a commitment to the seniors, but also to our city and to its people. Through this new long-term care development, we can address the ongoing need for long-term care in Toronto faster and ensure that our most vulnerable have access to proper supports and services. Being here today with the Premier is a great example of what we can accomplish and what we can accomplish at wartime speed. When you hear of something we're talking about in 2020 that will be ready for occupancy in 2021, serving people and protecting them to help our residents, and done in a way that is sensible and yet innovative, using public land and using modular construction as we're doing in the city to provide more supportive housing for people. This is something that should bring smiles to the faces of the people that we serve. It is this kind of cooperation that led to the Safe Restart Agreement that the Premier made reference to, which will help Toronto and cities and towns right across Ontario to deal with the financial impacts of responding to COVID-19. And it will ensure that we can continue as cities and as towns to provide the services to people alongside the province that they come to rely upon as we restart the economy. And so I want to say thank you, because it is the first public occasion I've had a chance to be with the Premier in attendance at, and say thank you to the federal and provincial governments for the financial assistance to be provided under the Safe Restart Agreement, with special recognition of Premier Ford's role standing in for the cities and towns of Ontario throughout what were very complex and challenging negotiations. Never did I once have to worry about him wavering on the need to find a support package the two levels of government could agree on to help cities and towns. I know that that is good for Canada and it's good for Ontario, and the Premier shares that determination with me. May I just say in conclusion that today's announcement is part of making sure that we're on the right track for a good restart. This is part of it too, how we care for some of our most vulnerable citizens. I want to thank the province of Ontario for investing in our city, for investing in long-term care, and for recognizing the need to invest in this type of support for all of our residents, but most especially for our seniors who have worked so hard over the decades to make this what it is, this province and this city, the best place in the world in which to live, and we want to make sure we keep it that way, and that is a significant step, this announcement, in that direction. Thank you very much.
Good afternoon, everyone. My name is Roman Baber, and I'm the local member of Provincial Parliament here in York Centre. We're a diverse community in North Toronto, and I'm proud to represent our growing constituency. I'd like to thank Premier Ford, Minister Fullerton, and all the folks here at Humber River for this great announcement. I also want to thank all of the wonderful staff at Humber River Hospital who have been working day and night to keep COVID-19 at bay while delivering remarkable quality of care for local patients and families. I'm blessed to represent one of the largest seniors populations in Ontario. Today's announcement delivers on our government's commitment to ensure that seniors get the care and dignity they deserve. The project announced today will benefit our community for years to come and ensure that our most vulnerable seniors live in a modern, clean, and comfortable setting. I look forward to continuing to work with Premier Ford and our entire team to fix the broken long-term care system we inherited and deliver 30,000 long-term care beds over the next 10 years. Thank you all for coming, and it gives me great pleasure to welcome Premier Ford to York Centre. Thank you very much, Premier.
We'll go to the phone line for questions. Just a reminder that it's one question and one follow-up, please.
Christine, before we take questions, I just want to announce our government will be providing $2 million to the Red Cross towards the relief efforts in Beirut. I want to especially recognize my friend Greg. He's the Honorary Consul General of Lebanon in Toronto. Greg, you're doing a great job, and thank you. It's one of the largest contributions Ontario has ever made to an international relief effort. And it's a terrible, terrible tragedy, and I just want to say my heart goes out to those injured and to the families of the victims. We stand with the people of Lebanon and with the Ontario's vibrant Lebanese community during these difficult times. We'll always have your backs. Please stay safe. Thank you. We'll take questions.
First question.
First question comes from Sean Jeffords from the Canadian Press. Please go ahead.
Hi, Sean.
Good afternoon, Premier. I wanted to ask you a couple of questions about Windsor-Essex as it approaches stage 3 of reopening. We found out today that on-farm testing in the region has so far only conducted about 30 or visited 38 farms of the 176 in the region. And I'm wondering, given that's the case, how the province can be certain that COVID-19 rates still aren't very underreported on farms in the region.
Well, Sean, thanks for the question. What we do is through Ontario Health and Public Health down there, we organize days that we come over to farms and we do the testing. And what I like to see all the farms tested 100%. I'm up here constantly begging and pleading the farmers to have the Public Health in there to do the testing. So do I want more? 100% I do. Am I pushing? I'm pushing constantly to get these migrant workers tested, and we're doing everything we can. But the good news is we see the number of cases declining right across the province. There's 33 cases reported, but still in saying that, We can't take our eye off the ball for a second. And what's the most impressive thing about those numbers is the amount of people that we're testing as well. So we're well into the 20,000s, closer to 30,000 some days. But that's what's impressive, and I just want to thank the people from Ontario for doing an incredible job and following the protocols and the guidelines of the Chief Medical Officer.
Follow up. Sean, follow
Yes,
up.
so in regard to the testing, though, I mean, I'm trying to understand from your perspective, Premier, what has changed in the region over the last week that has given you confidence that there will not be a spike in cases, both or either on farms or in the community?
Yeah, Sean, I guess no one can guarantee there's not going to be a spike or a second wave or during the flu season. But I take the advice off our public health officials and our Chief Medical Officer and our health table. And that's who I rely on every single day to give me the proper advice. And I'll tell you, they've done a pretty good job. Matter of fact, they've done an incredible job right across this province. I'm very grateful for all their help. But I'm not going to take our eye off the ball down there. I'm going to be down there on Thursday, down to Windsor, and I'm going to visit the folks there and just get the feel on the ground. That's the most important thing.
Next question.
Next question comes from Cynthia Mulliken from City News. Please go ahead.
Hi, Cynthia.
Hi, Premier. So in the U.S., more than 97,000 children tested positive for COVID-19 the last 2 weeks of July. I'm wondering if this is raising any alarm bells for you, because it certainly does show that children can catch it. And I'm wondering if that is giving you any pause in the what seems to be the government's refusal to put caps on class sizes in the elementary grades.
Yeah, well, we're doing everything we can. I always say, Cynthia, we have the best plan in Canada. People from other provinces want our plan, and we're going to do everything we can. And I'm not going to spare a penny. I'm not going to spare anything, making sure that we have the safest classrooms in the country. And I want to thank the cooperation of the unions. And by the way, we've met with the unions over 120 times. These are staggering numbers, 120 times. We met with the teachers' unions, meeting with public health. We have great doctors on the health table. We're getting consultation from sick kids and other healthcare areas, UHN. So we're going to pull out every single stop here to make sure we have the safest environment for the kids to go back to class.
Follow up.
Would you consider, because the petition that's going around has now over 200,000 signatures calling for your government to lower the class sizes. There isn't going to be proactive testing under your plan. Would you consider that to ease and allay people's, teachers and parents' fears? Also, what about pulse oximeters? Sorry, you know those little things that attach on the finger. One epidemiologist I spoke to thought that would be a great way to test kids. It takes 15 seconds, it's painless, and it measures the oxygen in the blood. Would you consider anything like that per classroom? Could parents fundraise for that? Would you support fundraising for things like this?
Well, I'll defer that to our health table, and I can answer that tomorrow. I always say I'm not a medical doctor. But again, we have the smallest classroom sizes in the entire country, bar none. We have more protocol and guidelines than any other jurisdiction, any other province in the country, no matter if it's mandatory maskings from grade 4 to grade 12. I know other provinces are making it optional. Again, we're putting more money per pupil than any other province in the entire country. We have, again, more guidelines and protocols. We're putting $20 million into supplying face coverings for all the students, putting $25 million into custodians to clean, another $25 million into cleaning items as well. So by no means, we're going to do everything we can. And most importantly, we have to be flexible with the school boards. If they have a great idea, go for it. If you got a great idea, if you want to put a tent up outside, I think it's great. Just think outside the box, help out, do whatever you can, because they're doing a great job, the school boards, and the teachers are doing a great job.
Next question.
Next question comes from Stephanie Crozier from Kingston Whig Standard. Please go ahead.
Hi, Stephanie.
Hello, I'm asking about the return to school plan as well. The Liberals have called it half-baked. Today, Andrea Horvath is in Kingston and called it bargain-basement plan that pinches pennies on the back of our kids. What do you have to say in response to those critiques and parents who are naturally anxious?
Well, I understand why parents are anxious. I'm anxious. I don't sleep at night thinking. I called the minister the other day 4 times. You know, I'm onto him like an 800-pound gorilla, and he's only a little guy, so he knows we're all over it. But in saying that, we have the best plan in the country, bar none. Let's do our comparators. We sent our comparators off to the media. You can't even compare it. As I said yesterday, we have parents suing the BC government because they want the Ontario plan. I know Quebec, they're following some of our protocols. Same with other provinces across the country. So I'm proud of our plan. And I'm not saying, you know, there won't be bumps in the road. When you put 2 million kids back in the classroom, 160,000 teachers, what we want to do is create the safest environment for teachers and for the students to go back to school in a safe manner.
Follow up.
What's your message for school boards who need to re-examine their budgets, maybe reallocate funds that were for special programming?
And that's fine. Anything in large urban areas like Toronto, we won't spare a penny. If they have ideas, by all means. We're putting $30 million into a fund that they can hire more teachers. And if they need more than 30 million, we'll put more than 30 million in. But money's not the issue. It's safety, in my opinion, is the issue. And we've had some great advice from some of the best medical doctors in the entire country. So, you know, we're trying to do everything. There's no one that wants the schools, along with the parents, obviously, teachers, wants a safe environment more than I do. And I won't stop until we get through this. I'll be here every single day. I'm not going to miss a beat.
Next question.
Next question comes from Haley Cooper from News Talk 1010.
Hi,
Please
Haley.
go ahead.
Thank you. Hi, Premier. Russia came out today claiming that it's the first country to approve a COVID vaccine and that it provides immunity and that this vaccine works. And we just want to know where your trust level is on, number one, that they did develop this vaccine and that it does work.
Well, you know, I always say I only trust the person I shave in the morning, but in saying that, I trust Canada Health. I trust Ontario Health. I trust Ministry of Health in Ontario. That's who I trust. I trust our doctors. And if they have vaccine and they're going to spread it around the world, God bless them. Good for the Russians. But I would get approval from Health Canada and our Ministry of Health and Ontario Health. And if they think it's fine and the Russians come out first, God bless them. Good for them.
Follow up.
And my follow-up is, we're now in the second week of August, and you've been going very hard at this since the second week of March. It's pretty much been nonstop for you. So are you planning on taking a little time for yourself just to recharge the batteries mentally and physically? Because this is clearly a marathon and not a sprint.
I appreciate that, and I just can't take my eye off the ball. I just can't. I got to be here every single day. I'm not going to miss a day. I promise you, God willing, and my health willing, we're going to keep going at it, and I just can't do it. I can't take any time off. I'll take time off next year when we're through this. But in the meantime, we'll keep working hard. And, you know, I got to give a shout out to the docs and Barb, your team. Where's Barb gone? And Dr. Fullerton and Mayor Tory. Mayor Tory, you know, he wakes up, I think, at 4 o'clock in the morning. I don't know what time you go to bed at, Mayor, but this is one of the hardest working mayors there is in the entire province. He's doing an incredible job, and I just appreciate his partnership, his collaboration, getting through this. And that's what's getting us through this, are all the people. I always say I play the smallest part in it. Everyone else is doing an incredible job, and I just want to thank them.
Last question.
Last question comes from Lisa Shing from CBC. Please go ahead.
Hi there, Premier. We're hearing from occasional teachers that are doing supply work. They're worried about doing that work in a pandemic and that it could put their health and job security at risk, especially if they're bouncing between schools. Does the province have any plans to mitigate that?
Yeah. Well, folks, I just want to give a shout out to Lisa. Lisa asked about air conditioning. I have the right Lisa. Is that correct, Lisa? This is the air conditioning.
Lisa.
Yeah, okay. Absolute champion, listening to the media, came up with a great idea. Lisa, you're the reason why that company donated that air conditioning. You're the reason why we're putting air conditioning throughout the whole province's long-term care. So first of all, thank you and kudos to you. Anyone that goes back to work is very concerning, especially depends on what environment you're in. And it's the essential workers. They haven't taken a day off from the beginning of this pandemic. So again, with the teachers, we're going to create the safest environment that we can create through, again, advice through the medical team and our health team and advice from sick kids and UHN and all the other medical professionals. That's who we're going to listen to. I can assure you we're going to do everything in our power to make sure those classrooms are safe.
Follow-up?
And yeah, that's what you lose sleep at night, about the kids. 100%.
Thanks, Premier, and thanks for the shout out, but I've got to say I'm a bit disappointed that, the bill's not going to be named after me like you promised.
Oh, no, but there's no bill. So I found out, honestly, this is a story, Lisa, honest to God's truth. So I told our cabinet, I said, we're making sure this bill is named after Lisa, and they said there's no bill, it's just an order. So the Commander-in-Chief, Dr. Fullerton here, she puts an order through that we have to get it done. But believe me, we got to put a plaque on every one of these air conditioning units with your name on it, because you did an incredible job. So thank you. And but there is no bill. But there's another bill that comes up. I'll make sure we name it after you, Lisa. You played a critical role. I'm not even joking. I'm dead serious. You played a critical role. You have changed lives. We went through these heat spells. Just imagine sitting in these rooms when it's 100 degrees. I can't even imagine it. So you played a critical role, and I thank you. And I'm so sincere when I say thank you.
Go ahead, Lisa.
Premier, my follow-up is actually non-COVID related, but just asking for my colleagues who are doing this story. There's a growing forest fire in the Red Lake area in the northern part of our province today. Just wondering if you're able to provide an update on the size of the fire, location, and evacuee numbers.
So people always wonder, and it's not just me, it's the mayor. You get calls I got a call at 1:30 in the morning from the minister. That's why I always keep the phone right beside my bed. Minister Rickford, give me an update on the fire. We're evacuating, I believe there's 4,100 people. I just called the mayor a couple hours ago to let him know that all the resources are there for him. We were in touch with the Ministry of Natural Resources. They're all hands on deck as well. Our number one priority is to make sure we evacuate the 4,100 people immediately, and it's all hands on deck up there. So the folks in Red Lake, we're there for you. We're going to support you, and we're going to make sure that you have safe shelter, and we'll support you after this as well. Any homes get damaged, anything along those lines, we have our emergency team all over this.
Thank you, everyone.
Thank you. I appreciate it. Thanks, everyone.